Possibly the quickest way to access first-line therapy for insomnia is to use Sleepwell's recommended programs and resources. As such, this video describes how to use Sleepwell when working with a patient who has persistent, recurrent, or chronic forms of insomnia and is not using sedatives, prescription or otherwise. Sleepwell recommends CBTi based on its effectiveness and safety advantages over sedatives. With a 4 to 8 week CBTi program, the aim is to treat the underlying factors that are perpetuating insomnia. Within just a few weeks, and with the necessary effort by your patient, potentially lifelong, satisfying gains on sleep can be made. The key resource here is the Sleepwell Recommends webpage, which includes a curated list of mostly self-help resources that are all based on CBTi. The sleep-enhancing techniques of CBTi can be first introduced to and sampled by your patient using the 10 Tips for Better Sleep handout. And if your patient is contemplating sleeping pills and would like to see how CBTi and sleeping pills compare, they should review the one-page chart comparing the two treatment approaches. On the CBTi webpage itself, your patient can review the content by clicking on each square to have their questions about CBTi answered. What is CBTi uses a Q&A style to share information about CBTi. Click on each question to reveal the details, for example, a description of the 5 main components of CBTi, and see what's involved in a typical CBTi program. Getting started with CBTi links you to the Sleepwell Recommends page, and the I've selected my CBTi resource, now what? That square connects you to the 5 CBTi components. As we describe in another short training video for clinicians, have your patient click on these icons wherever they find them on the website to access information and key resources for helping them work through any CBTi program. And if you're interested in quick access to the research on CBTi itself, you can find it here. We've organized links to the research by age, comorbidity, and CBTi format. And you'll also find up-to-date insomnia treatment guidelines at the bottom of the CBTi research page. Of course, you're going to use your own approach and your own words, but here are a few suggestions to help you get the discussion started and moving forward. When insomnia is an ongoing problem, I recommend Sleepwell. It has very practical information and includes ways to get a good night's sleep without sleeping pills. The best way to treat insomnia recommended as first-line therapy by sleep experts is to complete a short program of cognitive behavioral therapy for insomnia, or CBTi. A good way to learn about CBTi is to review the information on Sleepwell's CBTi webpage, and you can sample the sleep-enhancing techniques of CBTi by giving the 10 Tips for Better Sleep a try. CBTi starts to work when you make changes to your sleep routine. Each CBTi program gives you step-by-step instructions and resources for how to do this. The Sleepwell Recommends page includes programs that the Sleepwell team has reviewed and recommend. They're all based on CBTi. There are books and digital options made by different sleep experts and health organizations. You select a program and work through it. It usually takes about 4 to 8 weeks to complete. Take a look at the included Sleepwell prescription for a list of the key resources mentioned in this video, and share it with your patient as is, or modified to your liking.